Hi, I'm Garrett, and I'm here to talk to you about living with scoliosis. Kids with scoliosis can do almost everything. There may be a rare instance where your doctor will tell you that you should have a specific restriction, but that's really the exception. And unless you're given these very specific restrictions, you should really do anything you want. Activities are good, exercise is good, and the more you do, probably the better for your spine and your body. So a lot of times kids, or more often parents, come in with concerns that backpacks are a problem, but in fact, there really isn't any evidence of this. So unless it's uncomfortable for you, or you feel like it hurts you, I don't really think there would be any need to have a restriction. I can't say that bracing is easy, it's not. But it's important to understand that if your consultant prescribes a brace, that there's really good evidence and that it makes a difference, and oftentimes it would prevent someone needing a surgery. So it's something that a lot of children will be willing to invest their time and effort in. In terms of the reaction of others, which is always a concern, when kids are young, it doesn't seem to be a problem at all. And for the very young kids, it's probably more frequent that all of their friends want to know why they don't get to have one as well. As kids get older, it gets a little bit more problematic. But I think that the patient themselves always seems to notice it and think about it far more than their friends would. More often, the scoliosis is more concerning for the person with the curve than their friends. The people they know really pay much less attention to it than the patients themselves. There are occasionally times where the curve is large enough to be really noticeable, but that's pretty unusual. There are groups such as Scoliosis Advocacy Group Ireland and Scoliosis Awareness and Support Ireland. These can be found online, and they are a way of connecting with other families who are dealing with scoliosis. Many doctors have patients and former patients with scoliosis who have had surgery or gone down the non-surgical path, who are very happy to interact with people with scoliosis and provide their experience. And that's always something that seems to be beneficial. Patients and families often ask if their curve will progress or get worse. In general, it can be a difficult question to answer. The general rule is that the younger you are when you develop a significant curve, the higher the likelihood of that curve getting worse. The second feature is that if the curve is larger, the chances are that it will progress at a much higher rate. The curve cap pattern can also be a predictor for curve progression. For example, thoracic curves tend to progress more than lumbar curves. For double curves or S-shaped curves, those with a right thoracic and a left lumbar tend to progress more than other types of double curves. Patients will sometimes ask if their scoliosis can be cured, and the answer to that is really no. Curves can be managed. It's important to realize that anything under 10 degrees is really not considered a scoliosis, and if it's over 10 degrees, then it's the real thing. It is scoliosis in that case, and it should be treated with bracing if it goes above 20 or 25 degrees. In a growing patient, surgery is generally more for patients with the most common form, adolescent idiopathic scoliosis, and they're considered for surgery if the curve gets larger up to 45 to 50 degrees. But it is important to remember that there is more to scoliosis management than just managing the curve, and you may also have to manage other things like pain. Pain is common, and it is important to address overall activity levels, stress, and lifestyle factors that can make your pain worse. Seeing a healthcare professional really depends on lots of variables. If the curve is under 10 degrees and a patient is done growing, they probably do not need to see anyone. If you have concerns about your curve shape or pain in milder curves, you can still seek advice from your physiotherapist or your GP. However, if the curve is significant, let's say it's over 25 or 30 degrees and it's a young child who is growing, that would warrant more investigation. So it really depends on different variables, the age, the size of the curve, the rate of progression, and whether or not it is associated with other variables like back pain or even nerve involvement, or if it happens in the presence of other medical conditions. The genetics of scoliosis is evolving, and we're learning more and more about it. The most common type of scoliosis is adolescent idiopathic scoliosis, and there is a genetic component. There are many different genes that are being discovered that are associated with that particular type of scoliosis. You don't directly pass it on to your children, but if you have a significant adolescent idiopathic scoliosis, your children have a higher chance of also having that scoliosis, but it's not a one-to-one association. It's what we call multifactorial in its inheritance.